The 7 Ps of teen sexual health appointments. Ever wonder what happens during a sexual health appointment? Do you imagine a face-palming invasion of privacy? It's not like that at all. But first, as a teenager, do you even need a sexual health appointment? The answer is, it depends. The older you get, the more you are responsible for your own health. That includes your own body and whether it stays healthy or not. Many things can affect the health of your body, including sex. So it's a good idea to talk to your healthcare provider about your sexual and reproductive health if you have had sex and/or are thinking about having sex. But first, what is sex? Sex can mean different things to different people. For the purposes of this video, sex is defined as genital contact. This includes someone coming into contact with your genitals or you coming into contact with someone else's genitals. Especially as you get older, regular sexual and reproductive health appointments are very important. Your healthcare provider can make sure you're staying healthy, help you stay protected from sexually transmitted infections or STIs, tell you how to prevent pregnancy, if relevant, and help you understand the concepts of consent. A quick note about consent in healthcare. Consent means you agree to have a specific procedure, test, or treatment done. Your healthcare provider should ask for your consent before touching or examining any part of your body. You can give consent either verbally or in writing. You can take back your consent at any time if you feel uncomfortable, change your mind, or just don't want to answer any more questions. See our video on consent, capacity, and confidentiality for more on this topic. So what happens at a sexual health appointment? Your healthcare provider should review confidentiality and limits with you at the start of your appointment. If they don't, you should ask them about their policy on confidentiality. Your healthcare provider will ask you several questions about your sexual health and sexual activity, and they may examine you to make sure you are healthy. If you have never had a sexual and reproductive health appointment before, you may feel nervous or unsure about what to expect. It's important to remember that not all appointments will require an examination. Do you have to bring your parent or guardian to your appointment? It's up to you whether you would like your parent or guardian to attend your appointment with you. Some teens feel more comfortable if their parent or guardian is there. Some teens do not want their parent or guardian to know they are having an appointment at all. Some teens will tell their parent or guardian about their appointment but go to the appointment by themselves. Now for the 7 Ps. Your healthcare provider should review these 7 Ps with you at your appointment. Partners, practices, protection from STIs, past history of STIs, prevention of pregnancy, permission or consent, personal identity or gender identity. Let's look at each of these, starting with partners. Your healthcare provider will ask some questions about your sexual partners to better understand your sexual health and assess your risk for STIs. They may ask, are you currently having sex or have you ever had sex? How many sexual partners have you had? How long have you been having sex with each partner? Practices. Questions about the type of sex you've had will help your healthcare provider determine if you need any tests and what type. They may ask, what type of sex have you had? Vaginal, anal, oral, etc. Protection from STIs. Your healthcare provider will ask you about protection to assess your risk for STIs, determine if you need testing, and recommend other types of protection. They may ask, do you use protection against STIs, for example, condoms? If yes, what kind of protection do you use? If no, why do you not use protection? How often do you use protection? In what situations do you use protection? Depending on your answers to these questions, they may recommend that you be screened for STIs, even if you don't have any symptoms. Tests may include a blood test, giving a urine sample to be tested, and/or a throat, urethral, cervical, vaginal, or anal swab. You may be asked to do this swab yourself, or your healthcare provider may do it for you. If you don't understand why you are having a test done, ask your healthcare provider to explain or provide more information. Past history of STIs. Answers to these questions will also help your healthcare provider determine your current risk for STIs. Your answers will also determine if you need to be tested or treated for STIs. Have you ever been diagnosed with an STI? When? How were you treated? Has your partner or partners ever been diagnosed with an STI? Did they receive treatment? Have you had any recurring symptoms of STIs? Prevention of pregnancy. Depending on your answers to previous questions, your healthcare provider may ask you questions such as, are you worried about getting pregnant or getting your partner pregnant? Are you using contraception or birth control? Do you need information on birth control? Permission or consent. You and your healthcare provider should have a conversation about consent and confidentiality, including the age of consent for sexual activity in Canada and what that means. For more info, see the About Kids Health article on sexual consent linked in the description box below. Personal identity, gender. Your healthcare provider may ask you questions about your sexual orientation and gender identity so they can provide you better health care. They should not make any assumptions about identity, attraction, or sexual behavior, and they should not pass judgment on how you answer. This information is important. Talking about sex can be tough, but your healthcare provider needs this information to give you the best care. Your health and welfare is up to you. Caring for your own health is a responsibility you will have throughout adulthood. For more information, speak to your healthcare provider. If you don't feel comfortable talking to your healthcare provider, you can find a sexual health clinic near you by visiting Action Canada for Sexual Health and Rights, linked in the description box below. For more information on other teen health topics, visit teens.aboutkidshealth.ca. For more information about your rights in Ontario, visit www.ontario.ca.